Hi, welcome to my channel. Thank you for joining me today. So today we are still carrying on with our series with regards to conditions which affect the tummy. And in the last few videos I have talked about conditions that affect the liver in particular, and we are carrying on with that. So today we are talking about hepatitis, and yeah, so stay with me and I will be back. So what is hepatitis? So simply explained, it is inflammation of the liver. It can be chronic or it can be acute. So acute means it's something that happens and it gets treated and then it resolves. But sometimes it can be chronic, which means that it's going to be recurring. So you will be treated and then it happens again and then you'll be treated. So that's the situation. It's at that point when it's chronic, there's no cure. It's not curable, if I should call it. There are 5 types of hepatitis. There is hepatitis A, B, C, D, E. So how do we distinguish between the 5 different types? So it's the way that they are transmitted from person to person. So type A and E, the vowels A and E, they are transmitted orally. That's how I always remember that. So A is transmitted through food or water. Okay, and E is transmitted through poor sanitation, i.e. through water, so dirty water, very common in less developed countries as well. Hepatitis B, C and D. So B is transmitted through blood and also through fluids between mother and child during pregnancy. And then C is a blood-borne transmission, and this is very common in individuals who use needles, especially for drugs, recreational drugs, and they inject themselves, and that's how that one is transmitted. And then hepatitis D is only occurs in individuals who already have hepatitis B. So that's why if you are a healthcare professional, it's a prerequisite for you having a job, at least in the West, that you have to have had a vaccine for hepatitis B, because you are going to get in contact with human blood as part of the job. So just to reduce that risk of getting hepatitis B. So that's the 5 different types of hepatitis. So in terms of symptoms, what are the symptoms? Jaundice, that is skin yellowing, or also it can be seen on the eyes. And then fatigue is another one, so tiredness. And you can also have nausea and vomiting, so feeling sick. And you can have loss of appetite as well as having abdominal tenderness. It's usually upper tummy tenderness as well. And you can have dark colored urine, so it's usually called Coca-Cola colored urine because of the color. And you can have clay colored stool, which is as a result of basically the liver is not working as it should. So things are not being digested as they should be, and hence the difference in the color of the stool. And then you can have joint pain as well as fever. In terms of investigations, so you will present to your clinician. What the clinician will do, they will request a blood test. In that blood test, they are checking on your liver and also checking on the markers for inflammation as well. And you can at the same time also have blood culture drawn up as well, so to check for any other infections. Yeah. So in terms of management, what would happen is it all depends on the type of hepatitis you have. So for hepatitis A and B, the management is really prevention via vaccinations, immunizations. And then for viral hepatitis, you would need to have antivirals to treat that. And yeah, that's it in terms of management. The very important thing with hepatitis, you need to have follow-ups as well. And in those follow-ups, you're going to have your bloods checked, and you're also going to most likely have scans as well, just to see the health of the liver at that point. I hope this has been helpful. If it has, then please share it with someone who would benefit from this. Otherwise, I will catch you on another video. Thanks you for listening and thank you for following this channel. So share this, subscribe and like. See you on another one. Bye.